is deep sea diving, physiology, and then the aviation, that what high altitude. So we have this deep sea diver. I'll just PowerPoint first, the pen. Okay. This deep sea diver, after a very rapid ascent to the sea surface from 20 feet deep down below the sea surface. So if it's the sea, for example, the sea surface, ano, so he was a diver, uh, he was there down. So this is a mountain, for example, these are mountains, ano. So we are here at the surface, the sea surface here. So he was diving down there at 20 feet. So 20 feet. And then the problem was that uh, he suddenly ascended up. Sudden. So sudden, meaning immediately. It should not be. Remember, doctors, it should not be. When you go down to submerge yourself down deep, very deep, please try to ascend slowly. Huh? Try to ascend slowly. Okay. You know what? I'll just go in advance before we answer this one, actually. So, remember, when you're a scuba diver, di ba, you use this one. You use this one. This is actually gas also. Di ba? Uh, Remember, you are introducing also compressed air. You're introducing compressed air into the lungs at the same time, because you know that there is less oxygen already down. Okay. Now, as you go down as well to the deeper surface, remember that you are meeting a force. You are against a force. Remember, it's so heavy down deep here. It's so heavy. Okay. So therefore, the heaviness as you go down, di ba, it's so heavy down. We have experienced that when you swim, di ba? So as you go down, remember there is it's getting heavier here. It's getting heavier. So what happens is that, for example, doctors, this is your chest. This is you, and this is your chest. Remember, there's a compressing force, going. There's a compressing force against your chest. So what happens? Remember, you were at one point you, di ba, you have your alveoli here, di ba, your alveoli. For example, in your alveoli in your lungs, you have here air, di ba? You have here, of course, nitrogen gas, you have here oxygen gas, carbon dioxide. So of course, you wear this one simply because you just need it, because you are going down to an area by which there is no oxygen. It's a very rare oxygen down. So you just need this one. So it therefore it's no, it's full here. It's so heavy. It's so heavy with gas. And remember that there is also a force that is against your alveoli, because you are going down deeper. And the heaviness is a force. So what happens, doctors? Okay, remember that di ba, remember in our previous lessons and in your lessons also with your histology, always remember, and with your previous classes when you were still in biology or nursing or medtech, in anatomy and physiology, remember that aside from the alveoli, di ba, we have here the blood vessels. Di ba, the capillaries, remember? The capillaries. And this is your interstitial space. This one, your interstitial space. Cervical capillary. So therefore, what happens is that what happens is that the gases here, the gas here would be displaced, would be displaced. It will it will go to the capillaries, of course. They will go to the capillaries. And the gases would be dissolved here, would be dissolved here. And you know that it is not good to be dissolving gases here in the capillaries. So, the reason why you have to ascend, you have to go back or to ascend slowly going to the surface is that you should give time for the gases that went here to the capillaries. You should give that, you should give time for that to go back to the alveoli. That's why you should ascend slowly going up so that you can give time for the bubbles of the gas. Because remember, the gas went inside the capillaries. So you were forming bubbles inside. So you should give time for that to go back to the alveoli. That's why you should ascend slowly. By ascending slowly, you are putting back the gas to where they should be so that by the time you are already at the surface of the sea, you are here already, the gas now that went back to the alveoli would now be exhaled, would now be exhaled. So therefore, because these bubbles went back to where it should belong so that they could go back out or be exhaled again, therefore the bubbles were now removed. Because what is the danger if you won't remove the bubbles? So for example, so I have one, you have one classmate here who is very uh is very who loves about nature, about, so, oh, Ian, you post about Ian. Where are you? Dr. Ian Ormeneta, you love to post about nature. So Ian, kindly open
Hello,
your
good
this.
morning.
You
Then ako.
di ba, Cindy, you can see in his posts, di ba, about nature, about fishes, about birds, about dinosaurs. So let me share. So Dr. Ian, uh, Dr. Ian, so if you, for example, Dr. Ian, you immediately, if for example you were this one, you were the scuba diver, if you immediately went up so suddenly, immediately, you are not giving time for the bubbles that are here in the capillaries
Went to your
consequent.
capillaries,
Consequent.
Doc.
Oh, oo. Yes. So what happens? You are not giving enough time for it to go back there. So therefore, if you ascend so immediately, the gases are still within the capillaries. So they are still bubbles there. And what is the danger? These bubbles, of course, in your capillaries could go to your brain, could go to your joints, could go to your heart. So therefore, could kill a person. Okay, ha? So therefore, now can you get me Dr. Ian? Ha? Dr. Ian,
Yes, Doc. Yes, Doc.
can you get, and the rest of the med one? Okay, ha? So therefore, now let's look at now the problem. So this clinical data, this deep sea diver, after a very rapid ascent to the sea surface from 20 feet deep down below the sea surface, developed dizziness. So most probably you're thinking that the air bubbles now went to the brain. Headache, confusion, and left shoulder pain. Wow. Probably bubbles were also forming in the capillaries of his shoulder joint, therefore producing pain. So therefore, in as much as we are integrating na, even before pa, physiology with radiographic anatomy, now look at this left shoulder, doctors. Look at this left shoulder taken few hours after. What would then be your logical and clinical radiographic diagnosis and explain or discuss this case through the CPPRC or clinicopathologic pathophysiologic radiographic conference approach. Okay, so let us look at this. Okay, so look at this. Look, can you see this white thing here? Okay, that's a white thing. So this is uh this is this is the cortex of the bone. This one. This is the cortex of the bone. This is the medulla of the bone. This one. Huh? So we have cortex. The bit a bit grayish is the medulla. Okay. So we have here a part of your, this is a part of a clavicle. So this is a part of your scapula. So the acromion of your scapula. So this is the acromioclavicular joint space. If you try to look at it, there's some sort of a white thing here. Actually, this is a sclerotic area, meaning a sclerotic. It is actually a pathology which could be, which is non-specific. And one of the connotation of this is that this area of the bone developed infarction. But infarction, when we say infarction, we mean death of a certain portion, death of a certain portion of the bone consequent to ischemia. Diba? When we say ischemia, we say there is a decrease in the blood supply on that area. And because of a decrease in the blood supply in this area, that portion of the bone consequently died, therefore producing infarction. So, what could have been the cause of the ischemia? It's simply because from the capillaries that should have, of course, be supplying blood to this area, we're having bubbles. We're having bubbles. So the bubbles were blocking the circulation. So therefore, you produce infarction. So we call this as osteonecrosis, meaning death. Diba? Necrosis means death. Osteonecrosis. So the cause of the osteonecrosis was consequent to the ischemia due to the bubbles that were formed in the blood vessel simply because this diver made a very, very rapid ascent. Okay. So, osteonecrosis can also be seen in other cases, like for example, not necessarily due to, you know what the disease actually this patient is experiencing is Caisson's, what you call as Caisson's disease, or okay, Caisson's disease, deep sea divers disease. That's the meaning. So Caisson's, huh? Okay, so uh, osteonecrosis can be also not just due to Caisson's, but it can also be due to trauma, for example, vehicular accident, huh? Old age, like that. So, there are many causes, but at least through this context in this patient, from Caisson's disease, actually it developed osteonecrosis. Okay, so I think we're ready now. So, actually, normally, uh, it should be this way. Okay, can start, ha? So, my clinical diagnosis po to this case is Caisson's disease, also called BENS. You call that also BENS, or decompression sickness, ha? Or decompression sickness with a radiographic diagnosis of features suggestive of osteonecrosis at the level of the left shoulder joint region. Okay. So, Dr. Ilani, do you know this one? Do you know who is this? Dr. Cindy, you know who's this? Dr.
No,
Ian Von
no.
Clifford. This is your
No,
Kuya
Doc.
Nico Uy. This is your Kuya Nico Uy, second year. Di ba he's a nurse? Di ba he was a nurse in St. Divine Word University? So he's now ahead of you for 1 year. So he loves actually scuba diving. He also loves gym. He also
Mhm.
loves to bodybuilding. Okay, so he loves physical fitness. So it is your Kuya Nico, Nico Alfred Uy. So second year, but it's the second year now. So uh, he knows already this case. Actually, is the model figure for this case. So therefore, Nico now knows that he should not ascend so rapidly. Okay, ha? Okay, we go further so that you learn more. So you get the bends, which is also called decompression sickness when nitrogen bubbles form in your system and block the tiny blood vessels. Okay. This can lead to heart attacks because they are blocking. Okay, the bubbles block. So if it can go to your heart, the blood vessels in your heart are blocked, it can hurt to heart attacks. If it can block the brain, it can block the if the bubbles block the uh, circulation to go into the brain, you will have strokes. You can also have ruptured blood vessels in the lungs because of too much bubbles and joint pain. One of the first symptoms actually of decompression sickness is a tingling sensation in your limbs. Okay. So what in the world are the bends? So bends is actually decompression sickness. Acute decompression syndrome, another name, or Kaison's disease, is an acute neurological emergency in divers. It is caused due to the release of the nitrogen gas bubbles that impinge the blood vessels of the spinal cord and okay, so we go. Okay. This is the mechanism I was telling you. Okay. As you go down, as pure Kuya Nick, okay, from the sea surface was going down. So always remember that nitrogen moves from high pressure in the lungs. Oh, this is the nitrogen, ha? Because this is the most abundant gas actually, di ba? In the atmosphere, nitrogen is the most abundant gas in the atmosphere. So nitrogen moves from high pressure in the lungs into the blood. Okay, so how does it move? Of course. So as I told you, you have here the capillary. For example, these are your alveoli, ano? These are your alveoli field. Okay. Normally, di ba? Normally, if we are in the surface, we inhale gas. Of course. So they go to our lungs. Okay. They may go to your capillaries, but from the capillaries they usually would go back, of course, to the alveoli so that they can be exhaled. Okay, remember that. Now as you were going down, of course, you have a tank. So you will have oxygen here plus the nitrogen that were there. Okay. And as you go down, you are of course having a high pressure down here. So that high pressure down here would be compressing your alveoli because you are going down. So the tendency would be that they would go to the capillaries, of course. So that's the danger because they will be going there. Okay. So therefore, a slow return to the surface, therefore, lets the nitrogen return to the lungs where it is burned out. So therefore, please slowly go up so that you will be giving enough time for the bubbles to go there again. Okay, so that they can be burned out. Now, swimming up too quickly doesn't give the nitrogen enough time to leave the blood. Instead, it can form painful bubbles. Okay, therefore, producing the bends. Okay. So, It's self-explanatory. For example, if the bubbles would go to the capillary system, it can go to the brain, you will have strokes, it can go to the heart, you'll have infarction, myocardial infarction, or chest pain. Okay, now, so uh, at what depth can you get the bends? The shallowest depth for a single dive producing bend symptoms was 10 feet, 3 meters with the bottom time unknown. However, most of the divers made several shallow dives and sometimes multiple ascents. So, causes uh, decompression sickness is caused by the formation of gas bubbles in the blood and tissues. At normal altitudes, we are here at the normal altitudes, nitrogen and other gases are actually exhaled or dissolved in the blood, as I was telling you, and and tissues. So as we inhale the gases, for example, the nitrogen and the oxygen, they can go to the lungs, they can go also to the blood vessels, but it normally should also go back to the ano to the to the alveoli so that they can also be exhaled. However, during severe changes in altitude and air pressure, nitrogen and other gases form gas bubbles. These bubbles block the flow of blood. This condition can be fatal if not treated quickly. So, at normal altitudes, they can go to the blood vessels, of course, diba? As stated here. From the alveoli can go to the blood vessels, but they are dissolved in the blood. Dissolved. They're just plainly dissolved. And then, and then, they should go back to the alveoli so that they can be exhaled. The danger with going actually down deeper, it's not simply because there's a high tendency really for the dissolved gases to form bubbles actually in the inside the blood vessel, so that therefore we should ascend slowly so that you can give time for the bubbles to go back to the alveoli so that they can now be, just as though you're already at the surface, they can now be released. Okay, okay, so with the drawing here, this is the problem. Okay, large bubbles, arterioles. So we have here the bubbles. So dangerous. Okay. So the bubbles could block the oxygenation going there simply because they will be blocking. So therefore you will have necrosis or death of a tissue. Okay, okay, down. So now we have these lessons. So symptoms, the less severe type of DCS is called DES1. It primarily results in the inflammation of muscles, joints, tendons, resulting in pain and swelling. This is commonly referred to as the bends. Although the pain may occur anywhere in the body, it is most common in near or an arm or leg joint. The pain becomes more severe over time. Itching, skin mottling, weakness, and fatigue also could occur. Okay. The more severe type is called as decompression sickness 2. This results in more serious systemic effects, including neurological symptoms such as numbness and tingling. In the most severe form, numbness may lead to paralysis and even death. Other symptoms of decompression sickness 2 include stomach pain, back pain, headache, dizziness, visions, vertigo, chest pain, shock. You really don't have to worry about symptomatology like one or two. Don't worry about yourself. It's self-explanatory, the symptoms. What is important is that you know what a bend is, how it forms, huh? Okay, how it developed. Okay, so treatment is hyperbaric oxygen. When we say hyperbaric, it's actually here. You can see this hyperbaric oxygen. So all cases of decompression sickness should be treated initially with 100%. That is hyperbaric, 100% oxygen until hyperbaric oxygen therapy. So hyperbaric oxygen therapy is 100% oxygen delivered in a high pressure chamber. Naman, high pressure chamber. Mild cases of the bends and some skin symptoms may disappear during descent from high altitude. It is beneficial to give fluids as it tries to help reduce of course, the dehydration. The duration of the compression treatment depends on the severity of symptoms, the dive history, the type of decompression therapy used, and the patient's response to treatment. How do we prevent? Limit the depth and the duration of deep sea dives. Okay, to prevent it, we should limit the depth and duration. Follow the standard diving guidelines. Avoiding diving if you are obese. Avoiding diving if you are obese, pregnant, have heart or lung problems, or have a recent joint or limb injury. Avoid excessive alcohol consumption for 24 hours before diving. Avoid flying for 24 hours after deep sea diving. Avoiding repeated dives within a 12-hour period. Taking ibuprofen to help prevent altitude sickness when hiking. Avoiding flights in non-pressurized aircraft. Okay. So, Caisson's disease, what are the other names? Dysbaric osteonecrosis, exposure to hyperbaric atmosphere, undersea diving space aircraft result in decompression sickness. So, mechanism, again, decompression bubbles liberated from bone marrow can form nitrogen bubbles from the capillaries liberated from the bone marrow can produce bone infarction by small blood vessel occlusion. So resulting in osteonecrosis. Okay. So look at this the normal. This is the right shoulder. Look at this. This is the abnormal one. Look at this one. So you have a sclerotic or a white area, suggestive of osteonecrosis, death of the cells here. Here not normal. So again, this is your cortex of the bone. This is your medulla. So for radiographic findings, Jukes arterial defect, subcortical band, I have cortex, you don't have to worry about that. That important lang ay you have seen what osteonecrosis could look like. Ah, so, okay, so Doctora, so we have here, I haven't, I haven't interviewed him yet. How about you, Dr. Dale Angelo Stigoy? Dr. Stigoy, hello? Open your video, please, Dr. Stigoy. Hello? Hello? Dr. Stigoy, open your video. You have, what was your pre-med? Dr. Dale, hello? Cannot, ano, how about, how about you, Dr. Graciela Batagos? Hello? Hello? Hello, Doctora. What's your pre-med? Dr. Batagos? What's your
Po.
medtech? Okay. So, RTR, graduate, ano?
Yes,
RTR graduate. Okay. So, look at this example also. Look at this. Oh. So, look at this. You also have area of osteonecrosis here. So, this is actually your right hip joint. This is your iliac bone. This is your ischium. This is your pubis. So you're your acetabulum. So this is your femoral head, femoral neck, greater tuberosity, lesser tuberosity of the femur. So you have here your hip joint space. So look at this, very, very wide. There's meaning there's an osteonecrosis that happened. This one is also it's also sclerotic. You also have osteonecrosis here. So that's all about dysbaric osteomyelitis. So you don't have to don't worry about that. That is just also an example for you, so that you can appreciate more about Caisson's disease. You can understand better. That's why I include pictures. Huh? Okay. So there's another osteonecrosis. So therefore, thanks a lot, doctors, for your generous interest in Macubis RTRMF, CPPRC Conference Challenge. So this actually your Kuya Nico. He's in Med 2. So he also loves nature. Look at this. He also loves giraffes and zebras. Okay, so we go, doctors, to the next topic. Okay, ha? So that we can have a review na starting. We can have a review na tomorrow because Dr. Cindy, Dr. Cindy, hello. Dr. Cindy, open your video, please. Oh, okay na. Hello. Oh, so, oh yeah. Okay, so you, uh, bi-monthly na next week, I think, ano? So, kind, oh, kindly, I actually reminded already Ma'am Zaza if how many points should I contribute, because I'll be contributing, I think, for the renal and for this one for PMA bi-monthly. Ask Doc if how many numbers, how many items, so that I should you can you follow up with that, then you follow up today, and then to ask Doctora, so that hopefully we can have a review na tomorrow, so that you will not be disturbed anymore by next week. Okay, just follow how many percent, if how many items daw doctor daw is following, so that I can start na my making questions, because it's not easy to make questions. Okay, so we go to the next. What's your time, Doctora Cindy? What's your time? So that we can, the earlier that we can finish, the better, so that you will enjoy lunch. I know you're already so much drained with Zoom. you're already too much you're already too tired with Zoom. Okay, so we should have an early lunch. Okay, so I'll go shift to the next. Okay, so let's go to our next topic. So, when we were discussing earlier about down deep the sea, let's go to above the sea at high altitudes. Let's say, for example, imagine yourself, we are now in the Himalayas, or we are now in the Andes Mountains in South America. Okay. Remember that to higher and higher altitudes, to the mountain peak of the Himalayas, or to anywhere, mountain climbing space vehicles, it has become progressively more important to understand the effects of altitude and low gas pressures on the human body. So this chapter by Guyton deals with these problems. Okay. So what are the effects? As you remember, as di ba, when you have been with airplanes, di ba, you have already been experienced going to an airplane, and when you go up the mountain, you like to because is getting slow therein up more oxygen, but the problem is the concentration is so you want to grasp oxygen because going up kasi the pressure of oxygen is getting smaller. Therefore, you tend to breathe. And because if you tend to breathe, you also tend to breathe out. You breathe in oxygen, you want to breathe in, you also tend to breathe out. So therefore, you are exhaling. So therefore, you are eliminating carbon dioxide. So you want to take in oxygen, you also rapidly would exhale. You are therefore taking out carbon dioxide. Always remember that. Okay, so look at that. When we say barometric pressure, just wait When we say barometric pressure, it is atmospheric pressure. So we are here in the atmosphere. We are here in the atmosphere. Okay. Here on the ground, we have the usual concentration of the nitrogen, the oxygen. We don't have difficulty breathing because it's the normal thing. Okay. It gives the approximate barometric oxygen. The table gives the approximate barometric and oxygen pressure at different altitude, showing that at sea level here, the usual here we have the barometric pressure is 760. Okay, the barometric pressure is 760. Okay, just take note of this. This is very important, this figure. 760. I don't think you will have difficulty in memorizing because you want to maintain an average of 75 in your exams because of passing. Okay, so 76, so therefore 760. 760 millimeters mercury. At 10,000 feet, 523. At 50,000 feet, 87, meaning it's decreasing. So the pressure. So when you say pressure kasi, when we say the pressure, for example, high pressure, meaning the molecules kasi are so close with each other. High pressure. If you say low pressure, the the ano the molecules are scattered. That's low pressure. Okay. The decrease in barometric pressure as you go up is the basic cause of all hypoxia problems in high altitude physio because as the barometric pressure decreases here as you go up, the atmospheric oxygen partial pressure remaining at all times slightly less than 21% of the total barometric pressure. At sea level, okay, it's about 159. You don't have to memorize the figures, no problem. I just would like you to show you the trend. But please let us remember this one, the 760. The barometric pressure is 760 at normal. Okay, so atmospheric pressure, also known as barometric pressure, is the pressure within the atmosphere of the Earth. The standard atmosphere is a unit of pressure defined as 101.325 PA, which is equivalent to 760. So this is the one, at least this one, we should know this one. It's not hard man to memorize. Kay 76, you have to maintain your grade of 76 at least to be very, very safe. But don't worry. If you get 75, that's definitely passing. Usually, the cutoff actually in the revelation is 60. Okay, so but try to maintain 75 as your driving force. That's still a high rate. Okay, you should aim for 75 at least to be very, very safe and to that's a good score. But actually, You don't have to feel depressed because actually, usually, it goes up to 60. Huh? So, but do not be aiming pa na ano na you will target 58, 50. Don't do that. Try to target higher than 60, higher than 75. Of course, that's for your own good. So you don't therefore forget. Will appear in the exam, the 760, ha? Millimeters mercury. The standard atmospheric pressure is equivalent to an atmosphere at around their celestial body. Earth's atmosphere is composed of about 7 to 8% nitrogen, 21% oxygen. Okay. So, you already have 1 point. So, the 760 point I believe is essential to memorize this one. Hypoxia. As you go higher to the mountains, the barometric pressure is decreasing, meaning the atmosphere. The pressure, if the pressure is high, of course, you have a compact molecules. High pressure. If the pressure is getting decreased, you have more scattering. Okay. So, what happens therefore to the oxygen? Okay, it's decreasing. Look at this. The pressure of oxygen, the pressure of carbon dioxide, it's also decreasing. Why? Because I told you, you are gasping for air. You want oxygen. So therefore, you try to breathe. Okay, now, as you also breathe in oxygen, you're also fast exhalation also. So therefore, you are releasing of carbon dioxide. No wonder as you go up, because you have more breathing, so therefore you are releasing also much carbon dioxide. So therefore, the carbon dioxide inside you also tends to go small. Okay, so that's just actually the trend. So this is important, and that trend is not just the one from important. In the case of carbon dioxide, during exposure to very high altitude, the alveolar carbon dioxide falls from the sea level value of 40 to lower values. Therefore, as I have given you an example, in the acclimatized person, when you say acclimatized, it's actually the adapted, the adaptations, the physiological adaptations that are happening to you so that you can survive the problem. Remember, your problem is the agony that you will be having as you go up because the oxygen is decreasing. Acclimatization are the changes in your body, adaptation changes in your body that are happening so that you can survive. Okay, so that's acclimatization. In the acclimatized person who increases his or her ventilation about fivefold, the carbon dioxide falls to about 7 millimeters mercury because of increased respiration. Okay, so let's look at this. High altitude can cause low oxygen saturation levels or desaturation of an individual's blood. It happens because of low atmospheric pressure at high altitudes. Oxygen saturation levels refer to the extent of hemoglobin is bound or saturated. Okay, to oxygen. Remember that your red, diba, doctors, you have your red blood cells. So your red blood cells, we have hemoglobin, of course. The hemoglobin ba? Because it is the hemoglobin which binds your oxygen. Okay, huh? And you know that iron, diba? The iron is very important because it helps in the production of hemoglobin. Okay, it is an essential component for hemoglobin production, the iron. Okay, so that if you have a good hemoglobin, of course, you can bind oxygen well. So we go. At high altitudes, oxygen molecules are further apart. That's what I mean kanina. At high altitudes, molecules are further apart because there is less pressure to push them together. So again, at high altitudes, molecules are further apart because there is less pressure to push them together. This effectively means there are fewer oxygen molecules in the same volume of air as we inhale. In scientific studies, this is referred to as hypoxia. We have hypoxia, decreased oxygen, because simply because as you go up, there's less pressure to push them all going all together or it's not actually lesser oxygen, it's just a lesser concentration of oxygen because of the lower pressure. Doesn't mean to say there's no more oxygen. There's less pressure kasi as you go up. Therefore, as you go down, there's greater pressure. As you go down the sea, but as you go up, lesser pressure. So therefore, lesser pressure, the molecules tend to be apart of the oxygen. That's why we tend to go into hypoxia because, okay, remember this, doctors. Here, if for example, this is the surface. Example, this is the surface. Ano? For every volume of oxygen that we inhale, we have pressure here. That's why the molecules of oxygen are compact because we are maintaining a normal pressure here. So, therefore, that volume, when you inhale, has compact oxygen. Now, the problem as you go up kasi, as you ascend, the same volume, you want to breathe the same volume, but they are few because the pressures is there's too much there's less pressure kasi up, so that what happens is that they tend to be apart. Okay, so you want to inhale this one, yes, you can inhale, but the problem is that lesser oxygen concentration. Okay, okay, so actually I've tried to make this very, very simple, and I really hope and I really appreciate if you understand, because this is the simplest thing that it's hard in the book actually. Even my Kaisons, it's hard in Gaiton. I tried to read that Gaiton, but I tried to simplify things so that you will be entertained and at the same time you can learn. Just like with what I did with the renal physiology, you understood, actually have understood. I'm thankful that you have appreciated how I lectured it. I tried to make it simple. The key actually to success is to make things simple so that you can appreciate it, and then you can you will appreciate it, you can remember it, you will be entertained, and then you want to teach other people as well. Okay, huh? So when we become mentors, because we're also getting old, I know that you will be the next generation of mentors to medical students. Please make things simple. Don't complicate it. So we try to, okay, so next. So remember, we are now in Himalayas. My God, if you are here at the top, you will die. You will really die. You will later on see. Don't go to the uppermost, please. There's no more oxygen there. So, okay. And when you go up, please slowly ascend. Do not go continuously. You'll die. That's why if you notice those people going up, they have rest periods in between. Huh? That's giving them acclimatization, meaning adaptation, so that they can adapt the the bad quality of living up, especially for people like us. But for those people living in Andes Mountains, diba, in South America, they have already been acclimatized because they were born actually there. But you will notice their features are different from us. You notice the Andes people, if you try to look at the picture later on, they are they are they're muscular, they have big chest, they have big heart. It's simply because they have already been acclimatizing way back, even if they were still young. Okay, huh? So this is the Everest. Do not attempt yourself to be here. It's so hard. So at least here, but I don't know people kasi is adventurous. They want the unexpected. That's the problem. Okay, ha? So that's pressure of oxygen here. We are very low pressure oxygen. So they are very far. That's why you cannot suddenly climb from sea level to 29,500 feet in a day. That would be like stepping out of an airplane mid-air. Your body will not cope with it. It takes days for your body to adjust at high altitudes, meaning it takes days for acclimatization, which is most of our high altitude treks at around 8 days long with rest in between. The action of coping up or adapting by your body or our body, the physiological responses we have to do so that we can cope up is what we call as acclimatization. Okay, okay, we have now number 4. Okay, so this will appear in the exam, acclimatization. Okay, ha? What happens to your body at high altitudes? Well, your body is used to a certain amount of oxygen at sea level. Here, here where we are used to a certain amount of oxygen, 21%. When it suddenly gets lesser oxygen, it naturally tries to compensate by trying to take in more oxygen. And what is the consequence of taking more oxygen? You exhale also so rapidly, you therefore remove your carbon dioxide. So, of course, therefore, if you want to take in more oxygen, our breathing becomes faster, natural. Next, your body recognizes that there is lesser oxygen in your blood. Okay, our body recognizes that we have lesser oxygen in our blood. So it compensates by increasing the quantity of oxygenated blood. This means that, therefore, your heart kasi in our body, they are lacking it is needed. So therefore, no wonder as we go up, as we ascend, our heart pumps faster. Our pulse also increases. Then, because we need more oxygen, therefore, our bone marrow would try to produce red blood cells because, of course, the oxygen should be carried by the to be delivered should be carried by the red blood cells, diba? Okay. Third, your bone marrow, therefore, is responsible for managing our blood count starts producing more red blood cells. And remember what hormone is that which helps? The erythropoietin. Remember, the erythropoietin from the kidney
Erythropoietin.
is a hormone. Erythropoietin, yes. So it is produced by the kidney in order that it will help in the production of the red blood cells by the bone marrow. The bone marrow, they have to produce more red blood cells simply because it is needed. Because the body calls for it. Because we have left decreased oxygenation already. It's we go up. Okay. So, therefore, your bone marrow, which is responsible for managing your blood count, starts producing more red blood cells. Red blood cells are the vehicles that carry around blood in your body. So, but having too many red blood cells, okay, is not good for, actually not good. They can cause a short of traffic jam in your body. Diba? What do you call that one when you're, when for example, if this is your capillary and you have just too many red blood cells, you call that as polycythemia, diba? Polycythemia. Polycythemia. So they tend to stick with each other, polycythemia vera or polycythemia, yes, mix too much. And they get to be so sticky. And because of that, the problem is that if you're so sticky, you cannot deliver effectively the oxygen going to your tissues. Huh? So it becomes a problem. It's just like the bubbles, di ba? It tries to block. So tries to block the delivery of oxygen. Just like so. That's the problem with producing too much red blood cells. So therefore, having too many red blood cells is not good for you. They can cause sort of the traffic jam in your body. Think therefore of the consistency of a ketchup, di ba? The ketchup, that's how your blood could become. It could also clot, especially during times of inactivity. Simply put, your blood becomes thicker. Okay. So we should be normally to have a, we say that we have a good oxygenation, di ba? You have that pulse oximeter. So if it is 98, 96, that's normal. But if the pulse oximeter, meaning the oxygen, can detect that it is already decreased, it's bad. Therefore, we have to be hospitalized because we need to have an oxygen, a more concentrated oxygen. Okay, because our tissues need, like, so oximeter readings are used on high altitude treks to determine the oxygen levels in your body. At high altitudes, your reading should not drop below 80. Okay, at high altitudes, your reading should not drop below 80. Now, so I'll include this one. So when I put a star, okay, so you should not be below 80. Okay, now since both your lungs and heart are working harder than usual, your body tries getting rid of any excess baggage that it might be housing. It does not deceive by getting rid of excess fluids, but persists as a useless body weight. No, don't worry about that. So since this makes you urinate more often. Now, since both your lungs and heart are working harder than usual, your body tries getting rid of any excess baggage that might be housing. It does this by getting rid of excess fluids. Therefore, you tend to get dehydrated. We tend to get dehydrated, okay? We tend to get dehydrated in this level. Why? Because our heart kasi and lungs are working so much. They need water to work. That's why if they're working too much, we are prone to dehydration. Okay. Your body tries getting rid of any excess baggage that it might be housing. So the tendency would be to, because they're housing so they're working so much, the tendency would be to get rid of the water. One form by which this water could be eliminated is to urinate more often. The scientific term for this is diuresis. Okay. So we go further. So at high altitude, it's normal to wake up in the night to pee because our hearts and lungs kasi they're working too much. So they try to get we tend to be dehydrated, and one form by which the reason why we can take hydrated is simply because water can also get lost in the urine. So it would be explained all the midnight nature's call when we are at high altitude. Another thing that may happen to your body is that you sleep less. Often your body forgets to breathe. No, okay, this is a good thing. So often our body now forgets to breathe deep in your sleep, and your brain suddenly wakes up you to remind you to breathe. We need to breathe because of course oxygen concentration man is low up in the mountain. That's why we tend not to sleep. We tend to wake more because that is nature's call for us so that we can breathe. Because normally if we are sleeping, our breath, we breathe, but it is actually not the very deep one. Here in the surface, here and where we are, we can breathe. We don't find difficulty oxygenizing ourselves when we sleep because the concentration of the nitrogen here is normal. So we really don't have to be breathing so deeply. But if above kasi, if you are at the mountain, we should breathe more deeply because we have less oxygen there. Now, therefore, if we tend to sleep and we are in the mountain, we should breathe deeply. But the problem with the normal sleeping is that the breathing is not really that deep. So therefore, it is a physiologic response of the body to have more wakefulness so that if we can awake, we can breathe more deeply. Huh? So that's what you mean by this one. Which is a form of acclimatization, of course. So, what you need to know about these changes in your body, the things you need to know about all these changes in your body is that your body goes through these changes occur while you're resting. Okay. Don't do not anymore. Don't we don't have to this one. I don't. It's not needed. Okay. So again, acclimatization acclimatization is the process in which an individual organism adjusts to a change in its environment, allowing it to maintain performance across a range of environmental conditions. Acclimate occurs in a short period of time and within the organism's lifetime. Okay. And actually, don't worry about this. We have pictures for this. The principal means by which acclimatization comes about are a great increase in pulmonary ventilation. So, what are the adaptations therefore? What are the things there in acclimatization? So, this will appear. This one. Okay, so a great in just what are the physiologic changes in acclimatization? A great increase in pulmonary ventilation, di ba? With like that. Because we need to have more oxygen, and then we also exhale. It is needed, di ba? Erythropoietin then will help in your red bone marrow, increasing diffusing capacity in the lungs. Of course, you should have an increase in diffusion capacity simply because oxygen is needed. So, increased diffusion capacity of the lungs, increased vascularity of the peripheral tissues. There is new vascularization. More capillaries are therefore produced. So are made, and increased ability of the tissue cell to use oxygen despite low. Increased ability of the tissue cell to use oxygen despite low oxygen. Okay. So this will appear, ha? Okay. Always remember, Doctor, ha? The bicarbonate buffer system, carbon dioxide plus water through carbonic anhydrase becomes carbonic as H2CO3 and will dissociate to hydrogen bicarbonate. Okay, ha? And then vice versa. But don't forget about this. Ha? Don't forget also about this one. Ha? How I would like to, I would love to remind you always about this. In our body, di ba? In our body, one of the catabolic product is carbon dioxide. Di ba? Carbon dioxide. How is carbon dioxide actually eliminated in our body? Because carbon dioxide is a waste product, di ba? From catabolism. How does it circulate in our body so that it can be eliminated through the lungs? It is actually to the form of bicarbonate. Okay, how? Okay, majority in the form of bicarbonate. But it it can also occur in the circulation through as a carbon dioxide. But majority of it. So look at this. Carbon dioxide goes to the interstitium. It will go to the red blood cell. Now, carbon dioxide, okay? Carbon dioxide plus water, di ba? Plus water becomes H2CO3. Then, so therefore, this one can go there, become a bicarbonate. Bicarbonate. That's why it is a major circulating form of carbon dioxide actually. And then the hydrogen here, the Bohr, di ba? I told you the Bohr effect. The Bohr, duha nga H. The Bohr effect. This one, it has to bind again with the hemoglobin. That's why it's double H. The hemoglobin, because by binding with the hemoglobin, it is to the binding with that of the hemoglobin by which by which uh, oxygen can be delivered here. Di ba? Ito, hydrogen combined with hemoglobin, which promotes the release of oxygen from hemoglobin, Bohr effect. Okay, so that this one, okay, like that. We'll go here. So that the oxygen can now go to the cells. Okay. Now, once it is already displaced, this one, carbon dioxide, di ba? Remember, there's also carbon dioxide that did not become like this one. May nasa kaliwa. So, it will join like that. Will join with the hemoglobin. What you call as the Haldane effect. Di ba? Carbon dioxide combines with hemoglobin. Hemoglobin that releases oxygen, then combines with carbon dioxide. Okay. Haldane effect. Don't forget, because this usually appears in the board exam, this one. So, I will include this again, ha? This one. Okay, so we go side in the blood is majority in the form of bicarbonate. And why it developed like that? Always memorize. Hard-heartedly this equation. It's not hard. Actually, even will solve your problem about the one why you wonder why it is bicarbonate. It's because of this. Okay, now as it circulates already, di ba? So, di ba, as you told you that this has to be eliminated as the carbon dioxide has to be eliminated, di ba? It will go to therefore to the lungs. So, therefore, in the lungs, carbon dioxide now diffuses from the red blood cells and plasma into the alveoli. In the lungs, carbon dioxide diffuses from the red blood cell plasma into the alveoli. This one. Oh, the carbon dioxide bicarbonate will go back So therefore, HCO3 plus the H, because the hemoglobin here, di ba earlier, we had a hemoglobin at 20 here. Now, as you go to the lungs, this one has to be go down na. This one has to be to do like that na here. Simply because the oxygen that in the lungs, di ba, we have an oxygen that we inhale, it has to go to the red blood cell, of course, so that they can deliver this oxygen. So it has to go. So therefore, for the bore, another one is that the hydrogen will now be removed. Okay, so that is the source. It's again, HCO3 plus H, it's to CO3, then carbon dioxide, water. So this one can now go out na. It can now be exhaled. Therefore, so don't forget about that. Therefore, if oxygen has already gone back here, the carbon dioxide here cannot be removed. Haldane effect also. And they will all go together to be eliminated. Don't forget about this. That is very important. The tendency for our body, because di ba, if you remember, we are losing a lot of carbon dioxide. We are also losing a lot of carbon dioxide in going up. And as we ascend, we're losing a lot because we're inhaling a lot of oxygen and we're also exhaling a lot of carbon dioxide. There's the tendency, therefore, because if you will be removing a lot of carbon dioxide, what happens is that, di ba carbon dioxide is a symbol of hydrogen concentration in our body. Di ba, if you have a lot of carbon dioxide, let's say respiratory acidosis, meaning there's a, for example, if you have a trapping ba, if you have a for example, your bronchi are constricting, so therefore the carbon dioxide cannot be removed from our body, di ba? So you will develop respiratory acidosis because of increased carbon dioxide. So meaning the pH of our body decreases. Meaning that the hydrogen concentration, because of pH decrease, it's high. So therefore, an expression of carbon dioxide increase will be that there's also an increase in hydrogen ion concentration. Now, if on the other hand naman, in the opposite side, if you will be delivering a lot of carbon dioxide going out of our body, so you have more carbon dioxide being exhaled, you'll develop alkalosis because the pH is increasing na because you have removed your hydrogen kasi. Okay, so how does it develop that you have to the tendency to become alkalotic if you have more carbon dioxide that's being removed? Okay, so this is how it goes. So for example, doctors, okay, look at this. If we were exhaling too much carbon dioxide, and I was telling you, carbon dioxide is actually a representation of the hydrogen concentration in our body. Look at this. Carbon dioxide plus water, H2CO3. And they will become hydrogen ion and bicarbonate ion. So therefore, this one has a relationship with this one. Now, if we will be removing too much carbon dioxide in our body, and therefore, this has to be removed as well. If you are removing carbon dioxide, it has to be removed as well. So, if you remove this one, what is left is the bicarbonate. So, we have the tendency to have an increased in the pH because it's bicarbonate. If you will be, again, if you will be removing a lot of carbon dioxide in our body through exhalation, this will this what will happen. So the kidneys would be excreting as well your hydrogen out. So therefore, leaving this one. So the tendency would be you will have alkalosis. That hydrogen. So look at this. This is the hydrogen here. It will be secreted out. Oh, so secreted, di ba? This is the lumen. This is the tubules. Remember? So the hydrogen has to get out. It has to be eliminated. Okay. Now, on the process of elimination, remember that in our body, there is normally, di ba, we have constant filtration, di ba? Filtration, reabsorption, secretion. One of the we as an topic before, one of the filterable substances would be bicarbonate. So, the bicarbonate that is filtered like that, it will encounter the hydrogen that was secreted out as a byproduct of this one. So, HCO3 plus H becomes H2CO3. Now, H2CO3 becomes water plus the carbon dioxide. Diba? So, that carbon dioxide will go inside. That carbon dioxide again will react with the water. So, become H2CO3 again. And then, it will become hydrogen plus bicarbonate. That bicarbonate now will go here to the capillaries. That's why the pH increases. We have alkalosis that will turn out simply because there was too much secretion. So therefore, from our exhalation, the tendency would be that we can develop alkalosis. Huh? Alkalosis simply because carbon dioxide or the hydrogen were being removed. Okay. So, how do we regulate our breathing? Peripheral and central chemoreceptors monitor the carbon dioxide and oxygen levels and adjust breathing accordingly. Okay, before I proceed further, because we're about to finish, don't forget about this, doctors. This will appear, the carotene sinus in our body, you just you just Google search the carotene sinus. The carotene sinus in our body, and the carotene sinus, at the carotid artery, there's a sinus portion. It is a mechanoreceptor. Mechano ba? Or mechanoreceptors or baro. When you say mechanoreceptors or baroreceptors, we have receptors here in the carotid sinus that are responsive. For example, if you have an increase in the blood pressure here, too much pressure here, the mechanoreceptors respond. Okay, so that by the negative feedback, it will revert. If there's too much pressure here, high blood pressure, it will try to signal to the brain to 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 say, please decrease the blood pressures because you have too much. Okay, so they respond. So we have here the mechanoreceptors. These are the mechanoreceptors that tend to 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 sense if the pressure here is too much or is the pressure too low. So you call it as baroreceptors, mechanoreceptors, and you said that the carotene sinus. Okay. So what I do is, so that I wouldn't forget, I say baroreceptors. baroreceptor, sinus, U. Now, we also have the so-called peripheral, meaning peripheral outside of the brain. We also have the so-called peripheral chemoreceptors. When we say peripheral chemoreceptors, we have two. We have the carotid body at the carotid artery also. We also have the so-called carotid body there. So try to consider the carotid body is carotid body. Okay, carotid, doctors, carotid body. So once you say carotid body, it is actually responsive to oxygen and carbon dioxide of our body content. Carbon dioxide meaning chemical, chemical, the chemical. Adi, the blood pressure, mekano or baro. But, sorry, but here, I will just drink water. But here, you have oxygen, carbon dioxide, meaning chemicals, and so the carotid body, O, just like oxygen, as well as the aortic body. In our aorta, there's also aortic body. So this is the carotid body. We also have aortic body. The aortic body, aortic body. The aortic body is also sensitive to oxygen and carbon dioxide content in our blood. But aortic body is also not just a chemoreceptor, but also a mechanoreceptor. Mechano ba or baroreceptor? Why? Because this is the aorta. Remember the aorta? So if this is the aortic arch, aortic body, aorta, di ba you have this is a large artery. It has high pressure. Can be cerebral from the heart ko dito. So it high pressure. So therefore, it is very sensitive to mechanoreception, to baroreception, into the pressure. So therefore, I repeat, carotid body O is only a chemoreceptor. Chemo. While aortic body is both having chemoreceptors and mechano or baroreceptors. Mechano or baro. While carotid baroreceptors. Again, this will appear in the exam. The carotid sinus only has mechano or baroreceptors. Carotid sinus, baroreceptors. The carotid body only has chemoreceptors. They're sensitive to carotid body or oxygen and carbon dioxide. While the aortic body is very sensitive to as chemoreceptors, carbon dioxide and oxygen, as well as a mechanoreceptor. Okay, ha? So, don't forget about that. Peripheral chemoreceptors and peripheral mechanoreceptors. We also have the doctors, we also have equivalent of central chemoreceptors. Central chemoreceptors, meaning to say receptive to oxygen and carbon dioxide. We can also have that one. When we say central, they're at the medulla oblongata. And this mechano, again, don't forget, these chemoreceptors in the brain, they are very sensitive to carbon dioxide because actually carbon dioxide, don't forget this, carbon dioxide is the greatest stimulus actually for respiration rather than about oxygen content. It is the carbon dioxide ko talaga more powerful. But carbon dioxide, to be more powerful, it has to be sensed. It is the chemoreceptor in the medulla which is very responsive to carbon dioxide. Chemoreceptors. But the peripheral chemoreceptors, oxygen and carbon dioxide both. But if in the board exam, which is more powerful in the stimulation of respiration, answer is actually carbon dioxide. Carbon dioxide. Okay, we go further. So therefore, location of chemoreceptors. Okay, so aortic bodies, di ba? Chemoreceptors. And then the carotid body, di ba? Here, the carotid body here. Carotid artery man yun eh. Di ba? If you remember, the arch of aorta has branches, the right common carotid artery, the left common carotid artery, and the brachiocephalic artery or the innominate artery, the left common carotid artery, the left subclavian. The innominate artery or the innominate artery would give rise to your right common carotid and right subclavian. Okay. So we have here the carotid bodies, chemoreceptors only, and aortic body mechanoreceptors and chemoreceptors as well. Okay. We also have the the central. So again, this is the periphery maninilak. The when say central, brain. Okay, so we have therefore here the central chemoreceptors na ini. Here at the medulla. Huh? They monitor the carbon dioxide. This one, it's more powerful actually, carbon dioxide content for respiration. And then the cranial nerves, don't forget, huh? The cranial nerves that are involved as well in our respiration. Okay, don't forget, huh? The medulla, don't forget, this will appear in the exam. The medulla oblongata, di ba, is the cardio respiratory center, huh? Vomiting center, di ba? Well, the pons could also be a respiratory center. Pons is also a respiratory center. Okay. But when we say the cardio, respiratory, and vomiting center is the medulla oblongata. I don't forget the vomiting center associated with medulla because if you remember, when we were still children, we were given medulla medicine by our mother. When we are sick, di ba, sometimes the medicine, they don't taste well. We tend to vomit. So vomiting center, medulla oblongata. Ha? So don't forget, this will appear in the exam. Pons could also be a respiratory center. So what is important is that for the maintenance of chemoreception, there are two nerves that are involved. Actually, the glossopharyngeal and then the vagus. Don't forget GV Hotel. GV Hotel, we always see that one there at the downtown. Imelda. Glossopharyngeal and vagus. So don't forget, doctors, this will appear. Cranial nerves 1, 2, 8, sensory. Cranial nerves 3, 4, 3, 4, 6, 11, 12, motor. Motor. Sensory motor nerves. While the 5, 7, 9, and 10 are mixed. Sensory and motor, mixed. And you know that the glossopharyngeal, the vagus, it is the 9 and then the 10. Glossopharyngeal is 9, vagus is the 10. So therefore mixed sensory and motor. So whatever is being sensed from the aortic body and the carotid body, they will also be the motor component to do a thing. So for example, if they sense that the carbon dioxide here is low because you have been removing too much from that, so therefore there will be a corresponding response. That's an example only. through the motor component of the same nerves. Okay. So that's it. The system responds when oxygen gets very low. So when we are going up, relevant at high altitude during chronic pulmonary disease, glomus cells also respond to PCO2. So don't forget, this respond for alterations in carbon dioxide and oxygen. Carotid body, the glomus cells. The glomus cells in the carotid body. Don't forget, this will appear in the exam. The glomus cell in the carotid body makes the carotid body responsive to changes in carbon dioxide and oxygen. So central chemoreceptors effect of PCO2. The peripheral chemoreceptors, they respond to changes in oxygen and carbon dioxide. But the central chemoreceptors, they are responsive only to carbon dioxide. So therefore, carbon dioxide is the most important controlling the rate and depth of breathing. So if, for example, in our exam, it will include there, which is more important in the controlling the rate and depth of breathing? Carbon dioxide or oxygen? Answer is carbon dioxide. Carbon dioxide is the most important factor controlling the rate and depth of breathing. So not much here, we have already discussed that. So chemoreceptor reflex. Okay. Again, don't forget aortic body, carotid body. Carotid body or the chemoreceptors. Aortic body, chemoreceptors, and mechanoreceptors, paro. While the carotid sinus, mechano or baroreceptors only. Medulla, don't forget, this will appear in the exam, contains the cardiac, respiratory, vomiting, and of course, vasomotor center dealing with autonomic involuntary functions. So therefore, important in the breathing, the heart rate, and blood pressure. Again, it contains the cardiac, respiratory, vomiting, and vasomotor centers. Answer is medulla oblongata. Okay, which controls the breathing, heart rate, and blood. It will appear in the exam. So, stretch sensitive mechano. Stretch sensitive mechano or baroreceptors located in the carotid sinus and aortic arch. Monitor the pressure of blood flow to the brain and body. Action for the record of normal blood pressure. While carotid body, only chemoreceptor lang carotid body. Okay, not much on that, Elvin. So baroreceptors respond to blood pressure changes. Chemo respond to chemical composition of the change in the blood, so carbon dioxide and oxygen. So therefore, before we end, finally, increase in red blood cells. And is it 12 o'clock already? Cindy, is it 12? Oh, so anyway, I will continue tomorrow kay before we have a little review na, we will finish just one na lang. Di pa man bukas na lang kay important. Amo na lang tira, amo na lang ito hiya. Amo na lang ito ra. So mahusay tiya tomorrow kaya ha? So sige, so tomorrow we'll continue mga 30 minutes then we'll have the review na. Doctors ha. So Dr. Cindy, please ask na ma'am. So pera ko na to akong contribution para makahimo na akong questions kay I don't want to cram so that we can have if everyone will have more review kuan na lang private moment na lang naton ayon lang free zoom na lang aton sunod ha aton and I'll say no problem. Okay, very good. So just update me, just update me. And then, if ever we have magkulang man nga ni kita, if we will be lacking time pa para itong review, we'll just have na lang mga 3 days before during the bi-monthly, 3 days before the bi-monthly, we'll just have the free 30-minute Zoom lang. Just anyway, just a review lang naman. We can do that. In daytime, of course, ay kutat gabi kay it's already tiresome. Huh? Okay, doctors? So,
Okay
thank you.
po, Doc.
Thank you. We'll pray, okay? In the name of the Father, of the Son, of the Holy Spirit. Amen. Thank you, Lord Jesus Christ, for a very useful session. Thank you for letting us understand about including those of the creation. Amen. And the Father, of the Son, of the Holy Spirit. Amen. Happy lunchtime and see you tomorrow.